All right, call this meeting to order. We got everyone, or no, she's got me. Perfect. All right, so first on the agenda is to approve the minutes from the 29th meeting. Let's look at these.
Did have a chance to look at it. I make a motion that we approve the minutes. Second.
All right, approve it second, all in favor? All right. So. We got Julia here. You put the hot seat. You are.
Are you, oh, sorry. Is there any relation to Maria living? No. Okay. I know her.
No, my husband came from Caribou.
Okay.
The oldies. So, I guess we wanted to come in because, I mean, the main reason was a pretty massive increase from their last, amounts.
Yes,
And so I think we,
and it's negotiable, so, I mean,
Sure.
it's what you guys decide, but we have to start somewhere.
we definitely want to hear, you know, where things are at with, because we've been obviously working with, kids nursing for many years. I still remember for a long time,
It's been a long time since we,
well, you guys only needed $1 for.
Right.
Because you guys had funding, which we always appreciated big.
right, so I'm reaching out to all the towns. Rockport hasn't given us anything since 2018, so. But Camden, has been giving us money, and so,
And I see that a couple years ago, we gave you 500.
Yes.
Yeah. So,
that's what they're giving us.
so I guess maybe start off by tell us a little bit about this nursing.
Sure.
That.
We have 2 registered nurses, 1 full-time, 1 part-time. I'm looking for another part-time nurse right now. And we go around, the nurses go visit patients at home and under doctor's orders. And so we have we don't get any Medicare funding, no federal funding. It's just, our funding is either donations or patients. We charge $30 per visit, but so many of our patients are either free care or a reduced rate at $10 a visit. So we're always trying to find some money to pay our nurses and keep us going. I don't know, I'll go tell you. In Lincolnville right now, I have 19 residents, which resulted last year in 152 visits. And most of them, 50% of them, like I said, are free. So in order to keep us going, we're looking for money from the towns to help their residents to have their visits ongoing.
When we reviewed this the last time, there was some confusion about what it actually costs per visit.
It costs to send the nurse out, it costs between $83 and $85 per visit.
So the cost is not.
Everything is subsidized.
Yeah.
Every visit, so
And you say 50% are for free?
either free or a reduced rate.
Okay, yep.
Question, so you're asking several towns for money,
I am.
okay? So there will be a total if they all gave what you asked, and what proportion would that total be of your whole budget? Maybe the towns, for example, are giving 15% of your entire budget.
Yeah,
I'm
okay.
just making up the 15%.
Right.
What's the actual number?
Well, I haven't figured that out, but our budget is for this year is $395,000 for the year. So the percentage for what we're getting from the towns is not much. And so we do send out appeal letters, and every year, like this year, our appeal letters went out in December for residents in Lincolnville and Hope. And next year we will do Camden and Rockport. So we just try to,
So looking at the numbers that you gave us, it shows that you have 152 visits in Lincolnville.
right,
And if you charge that at $30 a visit, which I know will cost you more than that, that comes out to less than 5,000.
that's right.
So, given that some of those are probably free and reduced, I mean, you're looking at, you know.
It comes to
You know,
12,000, not
Yeah, because if you have about 50% of them are pretty reduced.
Well, we're
Oh,
talking about
okay.
visits.
Oh, yeah,
$30
yeah.
a visit.
Yep.
No, it's not
152
I
visits.
just clarified that it's $80.
That's what they pay, but I'm
Right.
talking about what they charge the Lincolnville.
Thirty.
They charge.
Okay, yeah, right.
He's looking for what we get for income for it.
The big question that I have, obviously, like I said, this has went up, you know. A lot from the last time is we did notice in your budget here that you very drastically increased your administrative cost.
Right, I know it's a sticker shock.
$68,000, you know, for one of them and another 25 for the other one. And now you said you're looking for headcount, so I guess I'm just trying to understand that difference if, you know, you haven't added anybody.
Right. Or not that, well, I don't know. This is from last year. I haven't looked to see what we've got for Lincolnville residents for this fiscal year so far, but that was for last year. And we have been picking up some other people, but that's why Camden and Norfolk are gonna, I'm asking for more because they have more people.
Yeah, Julia, I think that the question was about salaries and not about services.
Right, yes,
Yeah,
because it's showing here, and again, just looking at the numbers you gave us, 2024 to 2025, your administrative was 46,967, but then in 25 to 26, it went up to $115,000.
that's because they hired an executive director, which is me. They didn't have one before.
Okay,
And so my salary went into that.
and the nurses payroll, the director of nursing, that also went up a little over $25,000 as well. Was that in mind?
Right, that's right. The director of nursing was getting $85,000 a year,
So industry standard.
right? Yeah, it's competitive trying to keep nurses because of the salaries. I mean, right now we're paying $42 an hour for our nurses.
Which is not, you know,
Pardon?
which sounds like that's not on the higher end of anything.
Right, I mean, the hospital pays a lot more.
Yeah.
But there's a lot of flexibility for our nurses here, and that's why they do it.
So I was wondering if you tell us a little more about sort of what kind of services are your nurses providing in the homes? Like,
Pardon?
what sort of services are your nurses providing in the homes?
Okay, they do wellness checks, they do med management. They do the vital signs, they do blood draws. I will say a lot of the nurses will pick up the patient's medications for them. And so many of our nurses will fix a meal, a lunch for them. Sometimes they'll sit for a half an hour and have lunch for the patients alone, lonesome. So they do a lot above and beyond the job.
That doesn't surprise me. I was just thinking, because in my line of work, I work with several elderly patients over the years, and you know, that's what I hear a lot, especially as people are getting older, that fear of, I don't have family around, I'm gonna be alone, who's gonna take care of me? And I think we're such a rural area. You know, I think that's a really huge thing. I see it when I work with, I just volunteering with the Homeless Coalition, and they working with far more people over the age of 80 than I would ever imagine. And it's quite frightening. I think this is a pretty amazing service. People want to stay in their homes, they want to stay in the community.
Right, most of them want to stay home, and that's why we try to keep them at home. I know one of our nurses, we have a patient that he lives by himself, and he has wood heat, and he didn't know how he was going to get his wood inside, and so she gathered some people. They put his wood in.
Above and beyond.
Now, are generally these people that don't qualify for any other type of in-home service?
No, if they qualify, a lot of times when they're discharged from rehab or from the hospital, they qualify for main health to have a nurse come in. For a certain period of time until the insurance says you can't have it anymore, okay? We can't duplicate the services while they're having main health.
Okay.
But once main health is gone, then we go in and do our services for them.
What are the qualifications to get you to visit, if call and ask you to, is there any sort of guidelines where you say we
No.
can come in, we can't come in?
No, sometimes they call themselves, sometimes we're referred to by the doctor or the hospital or the discharge planners. So it's a mixture of, and unfortunately, I've had somebody call me a month or so ago and said he was homebound and he was really sick and he needed a nurse to come and he said he lived in Lincolnville. So when I got the doctor's orders, looking at it, his address was not a Lincolnville road. So I called him up and he said, well, I get my mail in Lincolnville. And I said, I know, but you live in Northport. And I'm sorry, we don't go to Northport. And he said, what do I do? And I said, you can call the city of Belfast, but they didn't have a nurse at the time. So I don't know. So,
So it looks like you increased the number of employees from last year to this year. You've added a part-time nurse in addition to the full-time nurse.
well, the only increase right now for employees is me,
Okay,
but I'm going to increase it for another part-time
Okay.
nurse. And the reason being is my full-time nurse, if she wants to take a vacation or she's sick, I have to
Yeah.
have somebody else that I can rely on to do that.
exactly.
And eventually I'd like to have this part-time person for us to have enough patients for her to be full-time too. So,
How many visits can a nurse do in a week?
it varies. I'm gonna say my full-time nurse, she probably does 25.
Wow.
Because she's busy, and then my part-time nurse probably does 10.
And roughly when somebody comes into your program, how long do they typically stay? Is it
Well, that's the other thing.
and it would probably depend on the circumstance.
That's right. Because I've been asked before, how long does the nurse be there? Well, we try to between an hour and a half. If it's foot care, it's probably 45 minutes. If it's nursing care, it could be an hour, it could be an hour and a half. I've had it be 2.5 hours.
Okay,
Depends when you go there, what you find.
Yeah.
How sick they are.
yeah. And is there a time limit as far as, like years ago, my grandfather was in a rehab facility and 30 days was all Medicare would cover. So is there a limit with this, or do people get nursing care for as long as they need it?
And Patricia, you have to speak up because
I'm sorry.
I'm deaf.
Are people allowed to have the nursing care for as long as they have a need? Or does it stop after a certain number of weeks or months?
As
or
long as they
visits?
need us, we're there.
Okay,
If they get better, I mean, sometimes we're doing after surgery for a mastectomy or something, and then after a few weeks, they don't need us anymore, but
right.
most people, it's a long-term thing. And probably death is the only way. Sorry, but that's true.
And you don't get better from old age.
Pardon?
They don't get better from old age. So,
That's right.
You know, I think that's the
We don't-
question about.
Old age, we don't get better.
I think this is the frustration of insurance companies. It's like, okay, we'll provide you this care, but the need doesn't necessarily go away because the insurance companies say, I mean, I see it all the time. I don't.
Oh, the insurance companies are terrible. We get, yeah, but
But yeah, the need is, these are not things that just, you're gonna get better from.
right.
Yeah.
And when they do blood draws, we could have a patient in Lincolnville, you do a blood draw. That blood draw, that specimen has to go to the lab. So the nurse has to drive to Penn Bay to drop off the specimen. So, there's a lot of time involved with that also. And if And I will say, when the nurses are running tight with their schedule, they'll come to the office and one of us will run it to the lab for them, but. I mean, that's time consuming, there's mileage, because we pay mileage to the reimbursed mileage for the nurses. Oh,
What is the contract labor on here for? What do you use contract labor? for?
contract labor that we hired someone to do grant writing for us,
Okay,
and that was it.
because it increased by $4,000.
I know, because they didn't have one before. I think they had one for $1,000, and then the person that we hired did some grant writing for us, and she charged us almost $5,000 for the grant writing. I don't know if we're gonna do that or not. I just got through doing some grant writing, and that's not what I wanted to do, but.
How much did the grant writing?
how much
Oh, I
did-
see it, 32,000, I'm sorry.
Yeah. That's a whole nother ball of wax as far as I'm concerned, grant writing.
Well, there's a specialty skill too.
Yeah.
Yeah.
Yeah. And that's not what I was hired to do, and that's not what I wanted to do, but that's.
But it
what I
went-
did. That's what I did.
It went down with the grant writer?
Yeah.
The year before it was 35.
Yeah, we're not high, she's not doing anything for us right now.
Not getting a gold star, huh?
No. When you compare it to what we charged us and what we got back from
Got
it, it's like, no, let's just wait. And see what happens.
So it seems, if you can keep people at home,
Yep,
so they don't have to go into assisted living, you're saving money.
somebody's saving money
Somebody-
somewhere.
So my question is, who is saving money because of what you're doing? And shouldn't they be contributing? And because you're probably a lot less expensive than going into assisted living. So who
Who really
should
saves?
give you money to save themselves money? Who should be doing that?
Well, the insurance company saves money. That's who saves, Medicare saves money.
Mhm.
That's who saves money. Maine Health.
Trying to make you save money.
And of course, it's much better for the patient if they can be at home.
They thrive better.
Of course,
You
yeah.
know.
Used to be like anyone said, anyone who's seen it. And
Oh,
rehab and it's really about times they decline.
I'd like to get an idea of, so you're asking the town for 5,000,
Right.
negotiable. So 5,000, I couldn't see here, what's the revenue? I'll call it revenue from people paying the $30 fee, and I know a lot can't pay or there's discount. I just want to compare what you're asking the town for versus what you're getting from your patients.
Well, let me see.
Before, yeah.
It's in there?
I think it's in there somewhere.
Go the other way. Before that. Yeah.
Oh, you can see that far? Pretty good. Good. Impressive.
It is in there.
Yes.
Our services under
Services,
there's foot care and then
Yeah.
there's nursing care.
and this is the total, all of your
Yes,
whole, and not just Lincolnville, not broken out by Lincolnville.
right.
But still, we get an idea. Okay. All right, so, wow, and your whole budget is $395,000,
$95,000.
so your revenue from services is like. Yeah, 2%, yeah.
It doesn't pay my salary. Put it that way.
Yeah.
I'm assuming Camden is your largest town that you service.
Camden Rockport, they're both
Okay.
the same.
And do you know approximately how many visits you do for those?
God, I don't know if I put it in here. You would ask me that. I did know, but, I don't know if I have it in here. I wanna say Camden is 78 patients last year, and I want to say Rockport was around the same.
Okay.
But I just got through doing something for Camden, so it's like,
So probably 3 to 4 times more than Lincolnville.
Yeah.
So am I correct in assuming that the estimate or request from those towns were 15 to 20,000?
Well, I wish. Camden's 8,500 right now. And Camden has been, they will, filtering their money through United Mid-Coast Charities. And I have asked them, it come to my attention when I was doing research after I was hired, that, if we got money from the towns directly, then we don't have to license annually with the state, which saves us money, plus the time for preparation to do it, because the state asks for so much stuff. And so I've talked to the town of Camden, and they're willing to just give us the money directly, not filter it through, so that we can qualify, hopefully, to not annually relicense. So that will save us some time and money. And the reason I found that out is I was talking to Rockland District Nursing, so I've been picking their brains, how they do it. So, and they're willing to share information, and so, actually, their director and I are going to meet quarterly to go over different things and see, what we can do together. I actually held a CPR class, and 3 of their nurses came to the CPR class because they needed to be recertified. And I thought, why should they do it in their place and then I do it at my place? Let's do it together.
Right.
Yeah,
Smart.
save money.
Yeah.
Other questions, folks?
Any more questions? No? Yes, no?
Julia, thank you so much for coming out.
Thank you for coming.
You're welcome. And I'll be grateful for anything that we get.
We definitely mean the work you're gonna do is really important.
It is an important service, and I don't know what towns or people would do without it. I don't. And I'd like to keep it going. So, anyway.
Thank
So
you.
much.
Don't throw it out.
Thank you, Julia.
Thank you.
Thank you.
I appreciate everything you people do. I do.
Likewise.
Yeah, absolutely. You're doing the hard work.
Yeah.
Yeah. Yeah, we're not drawing.
You can only say that whole-
We have all the way to Julian.
Yeah, it goes there.
Welcome.
Last one in
All right, guys, well, what do you think? Do you want to start going down the list? I mean, the first one is Kevin, area nursing. The first one. Is the first one?
Yes, we do.
Okay,
It's Julia.
so he'll have some, not really questions, but concerns, obviously. It's a huge jump. If you look at their profit loss here, they're still doing good without increasing it. My concern isn't really with what they do, because I think what they do is tremendous.
Yeah.
Right.
My concern is, drastically increasing administrative costs, which isn't really the case. Other items like cell phone staff reimbursement, employee gifts, I mean, we're talking a couple $1,000s there. I'm gonna be honest, where I sit. I would be extremely hesitant to give them the 5,000 they're asking for. But I could see maybe a slight bit more than we want. Because they don't know what this year's gonna bring, nobody does, right? I would be hesitant to give $5,000. That's an extreme jump where it looks like we're feeding the administrative.
I'm wondering, by having Julia as the administrator, if she'll be able to do some of the things. Like, you shouldn't be paying RN wages to schlep blood draws from point A to the
He's got a
hospital.
carrier.
I mean,
Right.
I could do that.
Carrier, yeah.
I don't want to draw blood, but but I'm wondering if by having Julia there to do some of those types of things, if that will free up the nurses to do more skilled things. And I'm not saying Julia isn't skilled, but it just
Well, skilled nursing is different.
to pay nurses wages to drive blood down Route 1 seems crazy.
Sure, yeah. And my understanding just from kind of working related field, not medical, like, is it pretty much just happens, it's just. That, this sounds like a pretty small operation, sounds like Julie said, when they can, we do. But it's not like you have a runner who's another employee.
Right.
And so I think that definitely, and that's obviously the hope is. And my guess is, I don't know, just from, I mean, they do that just to have people that work there, and it's what you've heard too.
Oh,
But yeah, it's, I mean, I think the probably nurses are doing a lot of stuff, the nurses probably traditionally, it's kind of nature. Especially this kind, which is, it's different than like, they got a Medicaid service where they could pay anyone, they could do some of those things.
Yeah.
And so, how are you doing?
Yeah, I also agree they're doing really important work. Yes. But our budget last year was 9,600. This time it's close to 12,600. Knock off 3,000 and we keep the budget flat compared to last year, and they would still have 2,000. We could give them 2,000 and keep our budget flat.
And the issue with that is that somebody who didn't apply this year, reapplied next year, now we've got to inflate the budget.
Well, then we have to adjust.
Right, that's where you have to sort of juggle this around, and I see what you're going with the juggle. Once you give it to somebody, it's extremely hard to take it back.
Sure.
So. I personally was thinking more along the lines of $1,000, to be quite honest. That's double what we normally give them. $1,000 more than Rockport gives them. It is a great service, but like I said, if you look at the numbers, we're paying for every one of their visits if we give them $5,000. That's not what the town's supposed to do.
Yeah.
For what they charge, that their fee.
One thought.
That has not, you're looking at it backwards. It's not what they charge, it's what it costs.
Mhm.
And in that case, we're still coming out ahead as a town.
100%. And a thought I have too is that, just kind of historically, Kemet District Nursing has been around for a long time. But actually, how long they've been around, but for almost the entire time I've been on the budget committee, which has been a really long time, almost 20 years now. They never charged, they never asked for any money, but they always asked and kept on, they always submitted. Because they had received a pretty massive gift, like somebody left them money in inheritance. And so they weren't asking for money. So I almost feel like there's a certain, I'm not saying we give them $5,000, but there's a certain part of me that says they've provided the service all along, and they only ask for money when they need it.
Yeah.
And I think what we're getting is we need it, and I guess it's too, that might have been working pretty bare bones out to see that, some of their fundraising was down pretty significantly, which is another issue, but I guess I'm not thinking $5,000 either. I just kind of sticks my mind that they've been providing service for a long time, and this town, it's like we talk about things that are worth our town's money, and this one thing I think that's really making me do this is you look at, is this service something that's a benefit to people in this town? And this is a service that is clearly and has been, whether we fund them in the building, hopefully whether we fund them or not. But I just think with our limited funds we have, this seems like, really, this is like the kind of use for town funds that I really like personally.
I mean, just med management. If you have somebody who's not able to manage their medications, to have somebody come in and do it for them, that saves. So, I mean, who knows what happens if you take the pill at the wrong time of the day, or with food, without food, or you forget and you take it twice.
I'll like just have somebody come in there, because I think it goes south really quick.
Yeah.
You have something, and a lot of people I know don't have people checking in with them, family around. Nobody made, so they're gonna be the first to see. My background, of course, is social work, so I'm thinking social worker. I'm thinking this is somebody who's seeing where this person's at is assessing, and nurse and data with that, a lot of different things.
Right,
Where is this person? Are they, and is there an issue that's coming up? Because, you know, how often do we, our own health issues identified by the people around us? I mean, hey, I think we're gonna get that checked out. And I just think it's a pretty incredibly valuable service.
It is,
And there's nobody else providing.
right. Right,
And, yeah, can't rely on name health a lot of times. Because
no,
As our demographics, as we all get older, and we are a very old state, and the healthcare system is just encouraging people to try and do more on their own with what they have. So there's people aging in place, and like you say, that there's not always someone checking on them. I mean, even if they become dehydrated, I mean, that presents as if they're, you know, practically have one foot in the grave. It's just a simple thing like not staying hydrated. But these nurses also are able to check on the meds, but then also prescribe. So that helps with the liaison with whoever their primary care physician is, and it allows people to stay at home, which helps the healthcare system. And so yes, 5,000 is a huge jump, but I would hope that we could be generous with this because it's a huge service to our residents.
Well, and also like, you know, we want to live in town, not against each other. And I don't be a little bit, be a little bit lefty here, but that's, I think that is something that we do, and again, $500, let's see. But I can see.
2,500.
Wait, does anybody want to throwing out a number?
I move that we approve $3,000 for this application.
I'll second that.
Okay. Discussion?
I will say that 3,000 does seem a little high based on where we have been in the past. And I do agree that we are paying for administration cost, and the other towns are doing services of approximately 4 times the amount of what Lincolnville is. And if we just look at the pure math of it, if they're asking Camden for 85, the likelihood they're getting 85. I mean, it's a numbers game. They're asking for 5, hoping for 50%. That's in my head what's happening. But they're probably not going to get $4 grand from Camden. But even if they do,
But
let's
it's
say
like-
hypothetically,
it's not
even
a
if they
business.
do, we're only still only a
Right.
0.25% of what
Right.
their visits are. So then if we're doing 3, we're still, I would be more on board with 2, just throwing that out there.
Yeah, I'm forgetting, like, this is where we can throw in and kind of amend the amount, right?
Mhm.
I mean, I'm actually, I mean, I want to say, I want to agree with 3, but I actually have to agree with you there. I propose we move it to 2. Yeah, about $2,000. for this year.
Sorry, 3.
Moved, is there a second?
But
I would second.
we're still in discussion, right?
Yeah,
That motion.
yeah.
Yeah,
But
right.
I think we moved, is that the way it works? We
Yeah.
guys, we got this game.
On the 3,
Okay.
and then read.
I think you could do it the other way around. You vote on the amendment.
Yeah, either way you could do it, I mean.
Yeah, I think that's what I remember doing, is you vote amendment.
Vote on the 3 and then revote. Sometimes that's considered an amending multiple times,
Right.
but that's just because. On the other side of this.
According to Duncan's rules, as long as it had not been voted on, you may amend.
Yeah, that's what I remember. See, let's get it, we remembered something from the years. So I guess, you know, do we want to discuss the 2,000, or do we want to vote on that now? If that doesn't pass, then we can go back.
I'll vote on it, 2,000, I'll vote on 2,000 now.
Okay, so where the motion moved is for giving them $2,000, all in favor? So that passes. I know personally, I would like to give them more. But I'm also very aware, and also I think I'm thinking about what you were saying about this brings us to where we were last year, assuming we passed, you know,
I also think that being a budget committee, just because you add it in the budget, does not mean you have to spend it. I personally would like to see where these numbers go next year. I really would. I mean, we saw an increase in their expenses and a decrease in the number of patients that they're seeing. So, yes, we are the oldest state in the country, actually, but unfortunately, if you read the newspaper, a lot of people are, you know, in that age range where they're not seeing next week. So it's a sad thing, and I hope, you know, by me saying this, I don't have to have their services anytime soon, because they do a great job, and anything can be said about that, and they, you know, so.
All right, well, so let's move on to New Hope. So we're asking for $5 less than last year, $1,985. I'll entertain a motion.
Could we skip over the welfare and child care services?
They
They
didn't.
didn't submit.
They didn't ask, so they're not
Are
going.
you gonna give them a dollar this year?
Oh,
Is there something about that?
Yes,
yeah, okay, let's go, let's do a motion to that one.
Yeah, let's just go right down the list.
Sure. I forgot that we talked about that one. Down here, so yeah, so the Area Child Care Center, sounds like you're moved that we give the
Yeah,
dollar.
Absolutely, I'd like to keep them on the books at least for one more year.
Yeah,
I give-
Second, all right, all in favor, any discussion? Favor, all right. So now on to New Hope Habitat.
No, Habitat.
Habitat's not submitted for several years.
Do you? And
So
it's-
nothing.
Yeah, we
We did
gave
a
a
dollar
dollar
2
in
years
twenty
ago.
twenty-four, yeah, 2 years out. So,
If I have to interrupt, so that was that the $1 to the childcare?
Yep,
Yeah,
Okay.
yeah,
yep,
that's just gonna keep them on the books so they don't have to do the whole reapply.
and then Habitat has not asked for the last 2 years, we gave them a dollar 3 years ago. So New Hope, 1985,
Make a motion that we give New Hope for Women $1,985.
I'll second that. You know, again, I speak this every year, but this is probably another one of those incredibly important ones, one of those services that we hope we never need, but I know for a fact that it's needed more often than we should never hope.
So
They do pretty incredible work. They do education in schools, they do in shelters, they're helping find lawyers. Any other further discussion? All right, all in favor? Spectrum, last year we gave them a dollar. And prior to that, we funded them at a relatively significant amount. What do you guys think?
do we want to give them a dollar to keep them on the books?
I was thinking doing it one more year, and on the third year,
Yeah.
we don't apply.
That's sort of like we could do.
How out of line were they with their application?
But that's question when you're up there.
So they submitted an application, but only gave me one copy and they're supposed to give me 10. After emailing me and telling me they were gonna bring me 10 copies, so it's more,
Ah,
they're trying, there's just something there administratively that I'm not quite sure. I'm not sure what's going on, but,
Good reason to keep them on the book.
and I think last year they got it in, but they got it in late.
Hmm.
So they're trying, it's just not,
I move that we give them a dollar.
I second.
All right, all in favor? Like Flight of Maine, staying steady at $1,000.
They didn't ask.
They didn't
No,
ask.
they didn't ask, so that was.
One that makes my heart hurt. a
Oh.
little.
Yeah.
So, I'm gonna be honest, I obviously wanna keep them on the books another year.
Yeah.
It could be another, everybody knows labor is kind of hard to come by, good labor is even more scarce, so it can be just an administrative thing where they can. I think we'd be doing an injustice just to drop them, so I make a motion, we give them a dollar.
I second it.
All right, all in favor? Waldo Community Action Partners, I told you they go down sometimes. $34.95, I need some readers.
Yeah.
I make a motion, we give Waldo Community Action Partners $34.95.
Second.
Discussion on that one? All in favor? Nothing from Mola County for Wednesday for years. Nor the pet pantry for several years. Mola County Woodshed. What's it, $1,000?
I make a motion, we give the Waldo County woodshed $1,000.
I'll second it.
All right, and another community helping people, love that stuff. All in favor? Well, the county one, I don't know, what you mentioned, okay, hospice volunteers, $1,000.
I make a motion, we give them 1,000.
Second,
Everybody seconding you.
All in favor?
Thing that I hope I don't have to use for a long.
All right.
Let me ask, the Waldo County Pet Food Pantry, what did we give them? Anything? No.
Not for several years.
Oh.
Yeah, 0.
We haven't given them anything for a couple of years now.
They haven't submitted.
Yeah, just 1 year, I think they did it.
Okay.
That's all, right?
It is.
It is. All right, so I will, so any other business we want to discuss?
Oh, one other question. Okay, so the last two meetings, the Zoom AI wrote the minutes and I sent them out. I guess, am I officially taking over?
I don't know, you were pretty excited about it.
Well, I was just the software things.
Oh, they got.
yes, twist her arm.
Well, it's fun.
Oh, I was very impressed with the notes.
Me
Very good.
Fantastic.
Not that yours was not, not compared.
Yeah,
No.
that's all fine.
Good.
Yeah, so I'll,
Vote on that?
I'll get that. I don't know if we have to.
Just to be.
Oh, well, to be official.
Yeah.
Oh, I don't care.
Yeah.
So if you're offering your resignation?
I was so officially.
The role of secretary? You have a second?
Okay.
All right, all in favor? You're on, John.
But,
I know I missed that.
I guess Dave will be been sending me the reports. He gets the email. From when you close off Zoom, Dave's gonna get an email with the minutes in it right now.
I don't know, we'll talk about that.
Yeah, okay, so you'll, anyway, if you see him. If I don't get it from him, I'll be calling.
I'll let him know.
I guess
I did want to make an amendment to the one time I did take the minutes.
Yeah.
That had been done previously and Kayla should have been mentioned in there. Kayla was
Oh,
very
yeah, I know.
helpful and clarifying at our first meeting, quite a few things, so my apologies for that.
Thank you, Dave, as
And
always.
that's- Yeah.
Do they have a,
I make a motion, we adjourn.
I'm seconding that. All right, all in favor?
favor.
See you guys.